Welcome to the Siteman Cancer Center Patient Education Video Library. The purpose of this video is to show you how to disconnect your CADD pump at home. We'll walk you through the process step by step to make sure you feel comfortable removing your pump at home. You can do this yourself, or you can ask your caregiver to help you. By following these instructions, you can safely and easily remove your CADD pump at home. Before you left the cancer center, you were given all the supplies you need. You will want to find a comfortable, clean place to sit down and a table or counter for your supplies. Make sure the workspace is clean. Place the supplies on the work surface in the order in which you use them. Have your telephone nearby in case you need to call for immediate assistance. Wash your hands thoroughly before beginning. Stop the pump and then power off by either pressing and holding the on-off button or removing the batteries. Next, you will close the two clamps. First, the one that goes to the port tubing, and then the other one that goes to the pump. Now put on your gloves and gently disconnect the pump tubing from the port access. Attach the red cap to the end of pump tubing and place the pump and tubing into the black bag provided. Using an alcohol pad, wipe the end of the tube for 15 seconds. Then let it air dry for 30 seconds. Now attach the normal saline syringe, the syringe with the white cap, to the port tubing, and then unclamp the yellow clamp. Flush the port line with 1 or 2 full syringes of normal saline, depending on how many you were given. When finished, reclamp the port line before removing the syringe.
This is the push-pause method for flushing CVC lines. This technique allows the saline to basically clean the inside of the device wall and help with removal of blood and fibrin while also preventing buildup of medication in the lumen. Evidence has shown using this type of flushing can be as effective as using heparin. For the push-pause technique, you apply quick, forceful, repeated pressure to the syringe and you inject 1 to 3 mL of fluid per push with slight pauses between each push. At the very end, you'll use a positive pressure clamp, and to do this, you will clamp the line with your final push or flush. It looks like this. And then the final push, you clamp it closed.
Next, you are going to carefully remove the dressing over the port site. Gently peel back the dressing, working from side to side. You are now ready to remove the port needle. To remove the port needle, hold the base with your non-dominant hand. Slowly pull the needle straight out until you hear a click. Once you hear the click, it means the needle has been safely removed and you can take the needle casing away. You can dispose of the port needle into the sharps container you were provided or an empty coffee can or empty milk jug. This can be secured and then thrown into your home trash. Check with your local trash service to find out about disposal of your sharps container. Now apply a Band-Aid to the port and dispose of your trash. You have safely completed the at-home port removal. Bring the pump back with you to your next treatment. If at any time you have a question about this process or need immediate assistance, call the BJC Home Infusion Support Line at 1-800-456-9366.